Jeff here, registered nurse and patient safety expert, but today I'm talking to you as an oncology and chemotherapy patient. Welcome to part 2 of the video on communicating with your healthcare team. Please check out part 1 of this video using the Q&A journal and other videos related to cancer patients' journey on the Gilda's Club website. In this video, we're going to be focusing on using your patient care portal. Many providers now offer an electronic patient portal where you can interact with your healthcare team electronically. You may hear names like MyChart at Northwestern Medicine, where I get my healthcare. It's called MyNM, or you may have other names. MyChart is one of the most common electronic patient portals used across the country. Now let's talk about some tips in using your patient portal. First of all, one of the things I've learned is sometimes not all your providers will show up on your portal. If you don't see them in your provider list, you need to contact your portal software administrator and get them added so you can communicate with that physician. Not all providers that you see will be on your portal. A good example is if your doctor's nurse calls you and she gives you direction to get on the portal and respond back to her, you won't find her specific name. You'll have to send the message to the physician, and the nurse that's part of that team will access it and see your message, but you can't access like Nurse Susie that's called you on the phone specifically on your portal. So what I do and recommend is in your portal header that you say, attention, Nurse Susie, Nurse John, whoever you talk to on the phone when you're communicating and responding back to a message. Remember not to communicate using your portal with critical changes or critical information, or you're critically ill. Every portal, every health system, every provider has timelines in terms of how fast they respond to portal messages. That may be anywhere from 2 to 4 days. So if you have a critical issue, you're going to have to still pick up the phone. My providers are pretty good about responding. Usually I'll see a response in 2 to 3 days from the provider message that I've sent. One of the other issues that I've come across in using the portal is that if your nurse and your physician are both off, for example, on vacation, you may not get a response. And so again, that's another scenario where you want to probably pick up the phone and see what's going on. And also, if you don't get an answer, you can feel free to remessage. Take the time in your portal when you're communicating to include dates and proper names of medications. Remember, you have a lot of patients that a provider may see, so as detailed as you can be, the better in your communication that you're communicating. It will help to orient your provider to give you a faster response. So if you want to send a message about a medication, don't say, the medication I'm taking for headaches. Try to be specific about the medication, the dose, and the frequency. It just helps your provider orient them so that they can respond quicker and more efficiently. Let's talk about reviewing your test results on a portal, because now they're posted. Sometimes they're posted before even your physician reviews them. This is kind of a double-edged sword. I know with the electronic world we live in, we're all anxious to get on Google and try to Google our test results and find out what they mean. So I really encourage you not to do that. Don't get yourself all excited, particularly if you don't know how to interpret the test result or the CAT scan results. Make sure you're talking to your provider before you start getting on Google and looking them up. I do encourage you to read your provider's clinical notes and consultations. Now, this is an area where you're going to see some technical documentation. Let's say your visit summary or your notes that your provider writes in your chart. Providers often use templates now So you want to make sure that the documentation really reflects your visit and your needs. Again, with the template, sometimes the providers will just generically use this template. So here's an example. I go to my provider saying, I'm having an irregular heartbeat. I can feel my heart beating fast or slow. And if the provider listens to my heart, she or he picks up, that it's irregular. But if you go back and read my patient care note from that visit, because they use templates, it'll say heartbeat regular without any rhythm issues. So also you want to look at things about what's called laterality, left or right. So if you're complaining about an issue on the left side of your body versus the right side of your body, you want to make sure that's accurate. I actually went to my provider a few weeks ago with an issue related to the right side of my body, but in my notes she wrote left. So then she ordered diagnostic tests and everything was saying left. So those are details you do kind of want to pay attention to in your provider notes, because they use templates and sometimes they always don't customize them to the assessment they've completed on you. Lastly, there is a trend now to use audio recordings in provider visits. You may want to use your phone to record a visit. You want to make sure that you've talked to your provider about that, they're comfortable with it. Every state law is different about disclosure and how those things are maintained, who has access to it. So you want to have a conversation. The other thing that's emerging is the providers actually recording your visit. So they are saying that they want to go back and listen to your visit and make sure they're catching everything you've talked about. That's really new and very interesting. You do need to give consent for that type of recording. Ask information about it and understand how the recording is going to be used and housed in your patient portal. As always, feel free to speak up and ask questions. We hope that these tips about using your patient portal have been helpful. Make sure to leave comments or suggestions below, and we look forward to seeing you on the next video.